Hello, everyone, and welcome to the Get Healthy to Work second webinar in our four-part series. As everyone will be aware today's webinar will be focusing on quit smoking for workers, the role, support, and importance of a workplace. My name is Nathan Rahani, and I'm one of the project officers on the Get Healthy to Work team, and I'll be facilitating today's webinar. So before we get into the webinar, I would like to acknowledge the traditional owners of the land in which I'm working on today. I'm joining this webinar from Camaragal land, and I would like to pay respects to elders past, present, and emerging, and acknowledge that across this webinar we'll be meeting on the lands of many different nations. Now, I'm very excited to announce that I will be joined by two great panelists today. On the webinar today, we have Ann-Louise Crotty, who is the manager of the tobacco control in the New South Wales Ministry of Health. Her team is part of the Centre for Population Health, and they're responsible for the tobacco legislation, which regulates smoking and using e-cigarettes in New South Wales. The team also undertakes compliance and enforcement activities in Sydney and other parts of the state. Welcome, Ann-Louise. We also have Phillipa Hastings, who is the Smoking Cessation Support Services Coordinator within the Screening and Prevention Division of the Cancer Institute New South Wales. She manages the relationship with the operator of the Quitline service in New South Wales. Phillipa has worked at the Cancer Institute New South Wales for 7 years in breast and cervical screening before moving to the tobacco portfolio. Welcome, Phillipa. So now we are just moments away from hearing from Ann-Louise and her presentation, but before we get into that, I will give you a quick overview of today's webinar. We will start with Ann-Louise's presentation on New South Wales smoke-free laws, smoking data, and the health risks of smoking, followed by Phillipa's presentation on support to help workers quit. We will then move on to the question and answer time. We did collect some great questions upon registration, which we'll take in when we go into the question and answer period. And if you have any questions during this webinar, please use the chat function on the Zoom meeting to ask us. We will filter through as many questions and try to answer them in the chat. And if time permits, we may bring it up in the webinar, but of course we can't promise that we'll get there to every question based off time. We will also be using a few interactive tools in the question and answer section. So you will see a poll pop up, and we would love for everyone to respond to those. I will talk everyone through them as they occur. And for the final part of the webinar, I will go through a summary of the webinar along with some key takeaways. So let's not delay it anymore. I'm going to hand the reins over to Ann-Louise for her presentation on New South Wales smoke-free laws, smoking data, and the health risks of smoking. Thank you, Ann-Louise.
Thanks very much, Nathan, and thank you very much to everyone who's joined the webinar today. So I'm just going to talk you through the situation of smoking in New South Wales, some of the health impacts of smoking, and the regulatory framework for smoking in New South Wales. And then just give you an example of smoke-free. In New South Wales, 1 in 10 adults are daily smokers, and tobacco continues to be the single most important preventable cause of ill health and death in Australia. There's a huge social cost associated with smoking. It's estimated to be about $137 billion a year in Australia. And in New South Wales, tobacco is responsible for about 63,000 hospitalisations in a year and around about 700 deaths. So that's why we're so interested in reducing smoking in the workplace and everywhere else. So this graph is showing you the percentage of adults, that's people over the age of 18 in New South Wales, who are smokers. So you can see the purple line at the top. The graph goes from 2002 to 2019. So the purple line at the top is the number of people who are never smokers. So pleasingly, we see that that is actually increasing. And the blue line towards the bottom is actually the number of daily smokers in New South Wales, and that's been decreasing over time, but over the last few years, that trend has stabilised. So I think a lot of us are very familiar with the smoke the health impacts of smoking. So just briefly, tobacco is the leading cause of cancer in Australia. Tobacco smoking harms almost every organ in the body. It's associated with cardiovascular disease. During pregnancy, if a woman smokes, it increases the risk of miscarriage, of stillbirth, and of a premature birth, and of a low birth weight for the baby. And then it has health impacts on after the baby's born. So the framework for smoking in New South Wales. So in New South Wales Health, we're responsible for the Smoke-Free Environment Act, which bans smoking and using e-cigarettes in all enclosed public areas and in certain outdoor public areas. So the purpose of the legislation is to protect people from exposure to secondhand smoke and to create a more supportive environment for those people who have quit and want to stay quit. So I think a lot of your workplaces would fall under the definition of an enclosed public place. So it's really an indoor space. So that includes professional trade, commerce buildings, includes cinemas, shopping centres, gyms. So all of those places you're not allowed to smoke. So in New South Wales Health, we're responsible for enforcing the legislation. So we have inspectors who all over New South Wales who go out and do compliance and enforcement to work. So they can issue a warning or a caution, or they can also issue an on-the-spot fine of $300 to people who break the smoking bans. So they also provide public education, and then they can provide businesses with assistance, if they want to put up smoke-free signage, or they want some advice on, how to manage smoking in their workplace. It's also a requirement, I should just say, that if you're a business that has the commercial outdoor dining area, you are required to have no smoking signage up at that site. So that's places like restaurants or pubs that have outdoor dining. And that signage is available from New South Wales Health for free if you want it. I'm just going to briefly touch on e-cigarettes because that's an area that sometimes causes confusion for people. So under the legislation in New South Wales, you cannot use an e-cigarette or vape in an area where you cannot smoke. So if there's if it's a no smoking area, it's also a no vaping area. So the position in New South Wales and the whole of Australia is that e-cigarettes which contain nicotine are illegal. So it's illegal to sell them. It's also illegal to sell e-cigarettes or e-cigarette accessories, and also tobacco products to anyone under the age of 18. So just to highlight an example of a smoke-free workplace policy is we're just highlighting here the New South Wales Health policy, but it could be anyone's policy. So in New South Wales Health, all New South Wales Health buildings and grounds are smoke-free, except for designated outdoor smoking areas if they're set up by a local health district. So you'd probably be aware that some hospitals have created smoking areas outside the hospital, but otherwise all of the grounds and obviously the interiors of New South Wales Health facilities are smoke-free. So that means that all staff must abide by the smoke-free policy, and they can't smoke in the grounds or in a New South Wales Health car. They're also required to inform patients and visitors about the policy and the support that is available to patients who come into hospital and are smokers. So that support does involve offering nicotine replacement therapy while the person's in hospital and maybe suffering from a nicotine addiction, but also it involves offering support services such as New South Wales Quitline, which you're going to hear more about shortly. So often what's required is to offer staff training in how to approach people about their smoking, particularly visitors who probably need some advice that they're not allowed to smoke on the premises. I'm sure that will be an issue in your workplaces as well if members of the public come to your workplace and you need to actually politely be able to approach them and tell them that they're not able to smoke there. So I suppose I would encourage people to think about in advance, if they're going to introduce a policy, how are they going to implement it? So for us, one of the areas where we get the most complaints is if there is a no smoking sign up outside a building and people can see that people are there smoking. So you need to think about both what's your policy going to say, but also how you're going to implement and who's going to do the implementation, and to offer them support and training to do that implementation. And just finally, just wanted to highlight that if you go to the New South Wales Health website for tobacco, you can make an online complaint about a concern you have about somebody smoking, but also there's a lot of information there for anyone who wants to know about the legislation and the implementation of the legislation. There's information for retailers, but we also have a tobacco information line where you can ring up and also ask for help or further information. And if you're a non-English speaker, you can get translation and interpreter support via that line. So thank you very much, and I look forward to the questions.
Thank you, Ann-Louise. What a fantastic presentation. A lot of great learnings out there for our audience, and I'm sure we'll dive deeper into them in the question and answer time. Now I'll pass it over to Phillipa from the Cancer Institute, who will be presenting on support to help workers quit. Over to you, Phillipa.
Thanks, Nathan, and thanks to everyone for taking time out of your day for this webinar. So I'm going to take a look at why workplaces should support people to quit, what support services, as Ann-Louise mentioned, what support services are available to help people quit. But first I'll start with a short overview of why quitting smoking is such a challenge for so many people. So tobacco smoking, I'm sure most people know this, but it doesn't hurt to reiterate it. Tobacco smoking is highly addictive. Nicotine is a highly addictive substance found in the tobacco plant, and it actually changes the balance of chemicals in your brain. So when you're inhaling tobacco smoke, it triggers a release of feel-good chemicals in the brain. Your brain becomes used to that nicotine and those feelings, so you need to continue smoking to get the same feelings. When you stop smoking, the balance of those chemicals in your brain changes in a way that can make you feel anxious or irritated, and that's what we call nicotine withdrawal. So there are ways to interrupt that physical addiction, but smoking is also highly social and contextual. It often starts as a social activity, so research shows that the peer group is a really significant influence through whether it's through peer group pressure or whether it's through individuals just seeking people who are like them or have similar interests. We also know that parental and sibling influences could be an even greater factor through normalising smoking behaviours. And on the habitual or contextual side, people commonly smoke at particular times, particular to them. So that could be, after a meal or with a coffee. So breaking the habits that are associated with smoking can be key to successfully quitting. So just moving on to the next slide. From a workplace perspective, why should you support people to quit? Ann-Louise touched on the harms associated with smoking, so I'll briefly cover the health benefits of quitting. They're both mental and physical, and there will be some improvements to some extent, regardless of how long a person has been smoking. So just looking at the mental health benefits, compared to people who smoke, non-smokers or ex-smokers tend to have higher levels of psychological well-being. While there is an initial decline in mood during and after quitting, the mood of ex-smokers tends to be higher than when they were smoking. And people suggest that they experience pleasure through smoking, that it helps them to de-stress. These effects that people feel when they are smoking, they actually look more likely to be the easing of nicotine withdrawal symptoms. So it's not necessarily a mental health benefit to continue smoking. So looking at the physical effects, you'll be aware that health effects, smoking, heart disease, respiratory disease. But what you might not realise, there are immediate and short-term benefits to quitting. So within 6 hours, your heart rate slows, blood pressure becomes more stable. Within 24 hours, levels of carbon monoxide in the blood drops, which enable oxygen to be carried to the heart and muscles more efficiently. After a week, your sense of taste and smell can improve. You'll have better circulation and lung function improving after a couple of weeks. And after a few months, you'll be coughing less and experience less shortness of breath. Looking at the longer term health effects, you have a reduced risk of heart attack after about a year of being quit. After 5 to 10 years, you'll have a reduced risk of different types of cancers and a reduced risk of stroke. And after 15 years, your risk of heart disease and death is about the same as someone who's never smoked. So looking at other factors around supporting people to quit, I do come from a public health background, so I have focused on the health a little bit. But from a workplace perspective, there are other factors that you might want to consider in terms of your organisation's risk profile potentially. So there's no safe level of exposure to secondhand smoke or passive smoking. Non-smokers who are exposed to secondhand smoke are at increased risk of lung cancer and heart disease. So I guess you really do need to consider the environments that your workers are placed in, which Ann-Louise touched on. Smoking is expensive. Depending on personal circumstances, it may contribute to financial stress for an individual. I guess you could consider how that impacts your organisation's risk profile, particularly around fraud potentially. And something that workplaces do tend to be quite interested in is productivity. Studies show that people who smoke miss more days of work and experience more unproductive time compared to those who don't smoke. Another factor that you might like to consider is tapping into your workers' desire to quit. So every couple of years we do a New South Wales smoking and health survey, which asks people a range of questions about their smoking behaviours. So the 2019 survey found that 30% of people who smoke think about quitting every day, and nearly half, 45%, are seriously considering quitting in the next 6 months. So providing a supportive environment and putting people in touch with support services could be a nudge that someone needs to make a serious quit attempt. So looking at what support services are available, Quitline is a free telephone service. It provides information, support and advice to people to help them quit and stay quit. It's staffed by professionals with expertise in smoking cessation. And as you can see on the screen, we have male and female Aboriginal advisors. We have advisors who are bilingual in Arabic, Cantonese, Mandarin and Vietnamese, and we'll use an interpreting service if someone needs another language. I guess the key thing to note about Quitline is the hours of operation. It's open basically when other services like a GP or a smoking cessation clinic may not be. So it's open early till late, Monday to Friday, and 9 to 5 weekends, public holidays, and that's every day of the year. So just on the next slide, I won't go through the details, but basically Quitline talks to people, asks them a range of questions and helps them plan their quit attempt. So there's images shown on screen, the contents of different quit kits, which is tricky to say. They can be ordered online, and I've got a link at the end of this presentation, or you can access them directly from the Quitline as well. So the I Can Quit website on the next slide, it supports people to quit smoking by providing an online savings calculator, which is quite a popular tool. You can see how much, or you can calculate how much you've saved by quitting. You can set a quit plan tailored sort of around your smoking triggers and quitting motivations. And one of the key features of I Can Quit, it has a forum which allows people to connect with others who are in similar situations. So sharing tips with each other, giving honest advice, strategies around how they've quit. And it's really popular and we hear really good things about it. There's a couple of other things. It provides a tool to track smoking and common triggers. So then you're able to use that information to break the routines that you've sort of fallen into, or those behaviours. And it provides a range of evidence-based information around the harms of smoking, the benefits of quitting, different strategies to quit. So the Quitly is a relatively new automated chatbot on the Facebook Messenger platform. It engages people in chats about their smoking. So again, you can set up a interactive quit plan. It does provide distractions to help you manage cravings. So it's important to know that a craving only lasts 1 or 2 or maybe up to 5 minutes. So it can give you games or breathing exercises or something to just help you get through that period. You can check in regularly and it will provide you with motivational messages. And again, you can calculate your savings through not smoking. The My Quit Buddy app is an app that has been developed by the Australian government. It shares a lot of the features that we have discussed on other platforms. So again, you can access a forum. It provides games and distractions to help you manage cravings. And something that we've heard is quite popular, it can send you reminders of your motivation. So you can put a picture of your family or maybe something that you're saving for. And provides you with key updates. I did notice on their website last week that a new app is currently under development, so you can check that out. And yeah, that's my final slide. I have just put a link there. That's where you can order some the Quitline resources, the quit kits that were in there. There's also resources on the New South Wales Health website if you wanted to see any fact sheets around smoking and going smoke free.
Thank you so much. Great insight into the support and resources available to individuals who want to quit smoking. Wonderful. So now we'll move on to the question and answer component of today's webinar. We'll start off with a poll for the first question. And so I'll read it out and then now the poll will pop up for you to answer. So the first question is it appropriate for a workplace to be involved in the quit smoking attempts of its workers? Philippa, how would you respond to this question?
Well, I would tick yes. There are a great number of benefits for the employee in terms of their health and productivity, and for the employer, again, around productivity and meeting safe work responsibilities. I guess over the longer term, successful workplace health programs can contribute to overall improved performance, I guess, around staff retention, efficiencies and productivity. And I guess something to consider also is reputation and corporate image. Knowing that a workplace has these sorts of programs in place is probably, it looks good and is attractive to maintaining a workforce.
Wonderful. It's good to see that majority of the participants also agree that a workplace should be involved as well. Okay, we'll go on to the next question. So this is linked to the previous question. Ann-Louise, you'll be best placed to answer this. So are workplaces obliged to have a smoke-free workplace?
I suppose from a New South Wales health perspective, we often talk about what the benefits are of having a smoke-free workplace, which is a lot of health benefits, which we've talked about, but there are also legal obligations. I talked about the Smoke-Free Environment Act, which we administer, which requires that, you can't smoke in certain places, which are pretty much all public indoor areas and some public outdoor areas. But there's also New South Wales work health and safety legislation, which places an onus on employers to ensure the health, safety and welfare of their employees. So managers are required to actually ensure that they have to minimise and have as little risk as possible and for employees, and that would include exposure to secondhand or passive smoking. So there are requirements, and I think in the past employees have actually sued their workplaces for exposure to passive smoking. So I think also if you look more broadly, local councils can declare certain areas to be smoke-free in their local council area. and that's looked after by local councils. And I know some people online today will be from councils. And so I suppose if your workers are going into those areas, you need to be aware that you have to abide by that legislation as well.
Yeah, absolutely. Sounds like there is that legislation that workplaces have to abide by, and there's also the opportunity for workplaces to do some extra work if they're wanting to actually support their staff to help them with that quit smoking process. So the next question is, if a workplace has the culture of smoking, example of smoke breaks, and they're scheduled every day, if not twice a day, what are some simple tips and advice to develop a culture that does not promote smoking? Ann-Louise, what would you say to that?
Well, I think Phillipa talked a bit about some of the triggers people have for smoking. So, everyday routines can be a strong factor for people in actually maintaining their smoking. So a smoko break, will be a trigger for people to think, well, now it's time for a cigarette. So what you want to do in your workplace is to help disrupt those routines and offer people an alternative. So, different workplaces would have, different opportunities to offer alternatives. One suggestion would be an organised walk, maybe at lunchtime, where employees, colleagues can join together and go for a walk. So rather than a trigger for a cigarette, it's a trigger for a healthier activity. But the activities you propose really have to suit your workplace and your employees. So I think it's important to actually have a discussion with people about both with the smokers and with the non-smokers about what are alternatives that the workplace could be looking at.
Absolutely. And this next question is very linked to that one about culture and how to best align your initiative. So what are the best ways for a workplace to align their quit smoking programs within their overall workplace health and safety systems?
So obviously smoking is just one aspect of an overall healthy workplace. And I would say that if you actually go to the Get Healthy at Work website, you get a lot of tips about, more general approaches that you can take. But I suppose we would encourage people to try and align their smoking, their reducing smoking policies with other health and safety policies. So it's useful to actually take it to your health and safety committee that presumably you'll have in your own workplace. Again, talk to staff about, what may and may not work in your workplace. So some of the things that we thought about when we were developing our policy in New South Wales Health that you might want to think about is obviously what's the awareness of the policy, and this didn't apply to health, but it might apply to your workplace. Can you actually sell? Is anyone actually selling and buying cigarettes on your workplace? You might want to think about stopping that if they are. Are there things like ashtrays around? You might want to remove those to encourage people not to be smoking. But I suppose another thing to think about is litter. So the cigarette butts cause a lot of litter. They're very unsightly. No one likes to work in a workplace with litter. But also that's kind of got, as Phillipa mentioned, a reputational issue for you. You don't want a workplace where everyone walks out the front door and stands around smoking and, leaving cigarette butts for that, all your customers are going to walk past. So I suppose there's quite a few things to think about when you're looking to develop your policies.
Absolutely. And to your first point, with the Get Healthy at Work program, so anyone can join the program. And if you're already part of the program, you can create a workplace health program that's specific to quit smoking. And when building your action plan, what we've done, we've tried to make your job as a key contact for the business as easy as possible. And so we give you over a dozen action items that cover 3 categories of people, base, place, and policy, where people actions focus on stuff that you can do for your workers. Place actions is more about the workplace environment, and policy actions is, of course, focusing on the organizational guidelines. And so for each of the different action items, we link you with different resources to assist you in the implementation part of it. And this could be in the form of a fact sheet, poster, policy template, and maybe some training materials as well that's available to you for free, or we even categorize actions based on investment. So if there requires an investment and you do have the budget for it, we've kind of categorized that for you to make it easy as possible to plan your action plan and implement it. So if you're interested in doing a quit smoking workplace health program and you want to get started, you can do that on the website. Or if you need some assistance, please do contact one of the Get Healthy at Work team members on our email. I'll be more than happy to help you out with that one. So for the next question will be another poll, but I'll read out the question first, and this one might be more placed for you, Phillipa, to answer. So how should a workplace support workers who have attempted to quit smoking but have started to smoke again?
Good question. So I guess it's really important to note that quitting can be very hard. There is that physical addiction. There's also the social and contextual factors that you've got to sort of manage. It does take a lot of effort to quit smoking. It's also something that can need to be practiced. It is quite normal, it's very normal for smokers to attempt to quit several times before they can quit for good. And I guess whenever a person relapses, it's really important for them to learn lessons from that experience and then incorporate those into your quit plan for next time. So, the I Can Quit website has information about your triggers and finding your motivations. And something that Quitline is really useful for, it will talk to you about, the advisors will talk to you about how you've tried to quit before, how successful that has been, and then they'll help you plan, the next time you're going to do it. Make that attempt. So I guess from a workplace perspective, if you have done things to help establish new habits, it's really important to keep those up. Really take a positive approach to it. A learning lessons approach to sort of take forward how that person can learn and take forward into their next quitting attempt.
Wonderful. Let me just share the results from our poll. So some of the options that we had available was a workplace should encourage employees to start another quit attempt. And we have 35% of our viewers think that's a good suggestion. 25% thought that workplaces should provide those recent quitters with flexibility in their workday to call Quitline or visit their GP. And the majority of participants thought that workplace should provide recent quitters with quit smoking resources, such as information about the health and financial benefits of quitting. So these seems like really achievable actions that a workplace could actually take, especially with the resources one. That could be a really easy win for any workplace to implement, just to provide information, free resources that are available through Quitline that they can just provide workers whenever they want to access it.
Yeah, absolutely. I think these are all really great suggestions, actually. If there was an option to tick all of the above, you probably would have done that. Certainly taking that positivity, you'll get it next time, that sort of approach, I think, is really helpful.
Absolutely. So move on to the next question. So if a workplace has a workplace health program that focuses on quitting smoking, what is the best way to let the workers know about the program? Phillipa, what would you think?
I guess that's going to be different for different workplaces. There's probably a range of ways that you're already communicating to workers, whether that's a workplace newsletter or all staff emails, posters in the break room, that sort of thing. So I guess it's really important to just adapt to how you're already working. Highlight the messaging around the program exists. I think the Get Healthy at Work website has a range of posters and other resources that you can tap into. So I'd really just encourage the workplace to as I think Ann-Louise mentioned before, just talking to people within the workplace and sort of coming up with a plan together, see what suits them.
Yeah, and to add on to that, one tool that we do offer through Get Healthy at Work within the Workplace Health Program is it's a tool called the Worker Survey. So you can create a link and send it out to your staff. And it's a 3-part question. The first question is asking the workers what they would like to see in a workplace health program and gives them 6 options of priority health areas. And the next question on the worker survey is about how they would like to receive information if they were to participate in a workplace health program. So it gives them options like a newsletter or lunch meetings, emails, fact sheets, that type of thing. And you can get the results live, and it's a good kind of needs assessment to understand how best your workers would like to receive information. You could use that to plan your communications to your employees and, based off what they want, and you can just communicate that to them. And that gets them a bit more involved in the process as well, and they're a bit more receptive to participate in the workplace health program through that way. So that's also free to access. And if you want help to access that, we're more than happy to help you with that. And as you mentioned, Philippa, we do offer fact sheets and posters and even email templates that you can use to promote your program to staff. The next question is, what support and resources are available for workers that are considering to quit or have recently quit smoking? And how should a workplace promote and or distribute these resources? Philippa?
That's me. So yeah, there's a range of resources out there for individuals. The Quitline is always available. It is a great source of information about quitting and planning how to quit, and it is tailorable to the individual. You can order the quit kits, which has a lot of information. It can be a little bit overwhelming, but you don't have to read it all at the same time. So you can order quit kits at icanquit.snap.com.au. I think that link is in the slides. Obviously, the I Can Quit website and Quitly are always available, and the My Quit Buddy. And yeah, so I guess in terms of promoting those, it's similar to what we've just covered, tapping into existing channels that exist for your workplace.
Wonderful. Ann-Louise, I've got a question for you, and this may be linked to the legislation. So can workplaces prevent workers from taking a smoke break?
So there's no legal obligation to provide smoking breaks in the workplace. And I suppose we would recommend that you don't have something called a smoking break because that really is normalising smoking in the workplace. And that's not something that you want to do. I suppose if you've got a strong culture in your workplace of having a smoke break, then you do need to think about ways to change that culture, which I think we've talked about. You need to actually provide support to staff and talk to staff about the best way to go about, either eliminating it immediately or eliminating it over a period of time. And as Philippa has mentioned, you've got to take into account that and acknowledge that for some people who've been smoking a long time and have a nicotine addiction, it's not an easy thing to do, but there's support available to them. But yeah, from a legal point of view, you're not obliged to provide it.
Sounds like the best strategy would be, as you said, to provide that support for those who do want to quit, change that culture so it's not normalizing smoking, and just create that safer space where people can access the support whenever they would like to. Yeah. Wonderful. So unfortunately, we are running out of time. So I will spend the next few final minutes to sum up what we've talked about, as well as give our panelists the opportunity to highlight some key takeaway messages if they would like to. So here are some of the key takeaways that I personally have gained from today's webinar, that there clearly are a lot of benefits, both at the individual level and the organizational level, when a workplace creates a smoke-free environment and also offers support to the workers who want to quit. There are workplace health and safety regulations where employers need to ensure the health, safety, and welfare of their employees at work. And by creating a smoke-free environment, you protect the health of your employees as well as the public from the effects of passive smoke. And that smoke-free environments are not only healthier for everyone, but it also helps the recent quitter to stay quit. So there are many ways that the workplace can support its workers to quit smoking, and these include creating a workplace health program to address quit smoking using the Get Healthy Work program. And we make it as easy as possible to equip you with all the resources to create a smoke-free environment, promoting free health services that assist smokers to quit, such as New South Wales Quitline, clearly signpost smoke-free zones to ensure all employees work in a smoke-free environment, and also promote information and resources to your staff on the benefits of quitting and quit smoking support strategies. Phillipa, did you have any final thoughts you would like to leave the audience with?
Just to note that there are a lot of services out there that are tailored towards the individual who's looking to quit. So it's just tapping into those. They're free and out there.
And Ann-Louise, would you want to take any final notes?
I suppose just that, there is a legislative framework, and, we certainly do enforce the part that we're responsible for, but I think you want to be in your workplace thinking about the support you can offer the staff. So it's not just the punitive approach, it's the support and encourage approach.
Absolutely. Well, thank you so much, Ann-Louise and Phillipa, as well as the support crew behind the scenes, Stuart and Greg and Nathan. So that brings us to the end of today's webinar. The next webinar in our series will happen on Thursday, 11th of February. And the topic of the webinar will be healthy eating at work, tips and tricks for you and your workers. It will be another lunchtime session, and you will have the opportunity to register for that webinar shortly. And we already have 2 great panelists lined up, and it will surely be another great webinar. And I'm very much looking forward to it. And so we will send out further information for that soon. Until then, thank you very much from the Get Healthy at Work team. And if anyone has any interest in finding more about the Get Healthy at Work program, please head to our website, gethealthyatwork.com.au. Thank you, Phillipa. Thank you, Ann-Louise.
Thank you very much.
Thank you. Thanks, everyone.
Bye.